Welcome to Living with Memory Loss, a community education program of Alzheimer's San Diego. My name is Amy Abrams, and I am the Director of Education with Alzheimer's San Diego. We are a local nonprofit organization in San Diego County whose mission is to help families today while finding a cure for tomorrow. Here is a look at our agenda for the Living with Memory Loss program. I'll start by providing a brief disease overview in which we will talk about the typical progression and common methods for symptom management of Alzheimer's disease and other forms of dementia. We will then talk about ways to build or enhance your support system. We'll talk about some practical strategies for coping with daily challenges. We'll provide an overview of some legal and financial issues that we want you to begin thinking about for the future if you're living with memory loss. We'll talk about some key safety concerns, some things to be planning for in the future, and then we will review some local resources for help and support. So we'll start with a brief disease overview. I want to start by providing some clarity around the term dementia. This is a word that causes a lot of confusion. It is often confused with or used synonymously with Alzheimer's disease, but in fact, dementia is not any one specific disease. Dementia is the word that we use to describe a group of symptoms that are caused by some underlying medical condition. That medical condition may be Alzheimer's disease, but there are dozens of different types of dementia. So it's a group of symptoms caused by an underlying medical condition that impairs a person's cognitive function. It causes changes to the personality or behavior, and often will interfere with normal daily activities. Dementia is not one specific thing. It is not a normal part of aging. It's differentiated by the fact that the changes represent a significant change from what's normal or baseline for that individual person. And as I described above, the symptoms are significant enough that they interfere with normal daily activities. Dementia is also not exclusive to older adults. Between 5 and 10% of cases of dementia occur in individuals who are under the age of 65. We call that a young onset type of dementia. The progression of the disease can be difficult to predict. As you see depicted in this graphic, what we generally predict is a long, slow, but steady decline in a person's function over time. It's notable that there are no numbers on this graph, and that's because the particular progression of the disease can be very difficult to predict for any one person. We typically say that Alzheimer's disease and other forms of dementia, a person may experience symptoms from anywhere between 2 and 20 years. There's lots of variation from person to person, but we do expect to see a progression from an early stage of the disease when symptoms are mild to a middle stage of the disease where the symptoms are more moderate, and on to a late stage of the disease when the symptoms are severe. Exactly what symptoms any individual person will experience and how severe those symptoms will be can be difficult to predict because there are dozens of different types of dementia which produce their own unique sets of symptoms. And there's also all of the variability of individual people, your age, other medical conditions, your overall health, and then of course things like how well you're doing on any individual day. If you're tired, if you're under a lot of stress, you haven't eaten well or had enough water to drink, for example, if you have an illness or an infection, for example, we may see a decline in function that will then improve in the short term. So while you see this long, slow, steady decline in function over time, you'll notice that it's not a straight line, that a person will have good days and bad weeks, but that over time we are going to see this progressive loss of function in all progressive forms of dementia. So at Alzheimer's San Diego, we use this simple 3-stage model to describe the various stages of Alzheimer's disease and other forms of dementia: early, middle, and late. There is no concrete, discrete moment wherein an individual has moved from the early to the middle or the middle to the late stage, but what we typically use as a marker to differentiate between these stages is the level of assistance that the person requires with basic tasks of daily living. So in the early stage of the disease, when the symptoms are mild, the person is likely to experience memory loss, and specifically short-term memory loss is very common in Alzheimer's disease as well as other forms of dementia. A person with early stage dementia is likely to be experiencing occasional moments of confusion or disorientation, and they are likely to be experiencing new problems with what are called the instrumental activities of daily living. Those are tasks like driving, getting the bills paid, shopping for, planning, and preparing meals. But they are not the basic tasks of daily living. The things like bathing and grooming and being able to eat. A person who's got mild symptoms, who is still in the early stage of the disease, is generally fully independent with all of those basic tasks of daily living. In the middle stage of the disease, the symptoms are more moderate, and here we begin to see more significant memory loss, more confusion, and more disorientation. The middle stage of the disease for most people is where verbal language and other types of communication become most challenging. In the middle stage of the disease, a person is likely to begin to have some need for assistance with those basic activities of daily living, those personal care tasks: bathing, grooming, getting dressed, eating, transferring from a lying to seated or a seated to standing position, or with mobility, or with toileting, for example. This does not mean that the person requires hands-on assistance with all of those tasks of daily living in the middle stage of the disease. But what it may mean is that the person requires reminders or some type of verbal or physical assistance. Someone to help, for example, get the shower turned on, get the supplies out, lay out the clothing, for example. The middle stage of the disease is where we're likely to see an increase in safety concerns. A person in the mid stage of the disease, because there is more of that memory loss, confusion, and disorientation, they may require more assistance, supervision needs. We may need to be more mindful of the risk of wandering at this stage of the disease, because in all likelihood, the person is physically as robust as they were before the onset of the dementia symptoms, but they now have a bit less safety awareness. And the late stage of the disease is generally marked by a requirement for assistance with all of those basic activities of daily living that I was describing before. So a person with severe dementia symptoms is likely to have limited to no verbal communication ability. A person in the late stage of the disease will absolutely require 24-hour supervision. They would not be able to respond in an emergency, for example, and they are likely to require assistance with all those activities of daily living. Again, it may not be that the person needs physical hands-on care, but they would not be able to manage those daily tasks on their own. In the late stage of the disease, it's not uncommon to see individuals who are having difficulty with chewing and swallowing because of changes in the messaging between the brain and the esophagus that make it difficult for the person to swallow thin liquids or food, a solid food. And in the late stage of the disease, we are likely to see very reduced, limited physical activity and limited or fully dependent mobility. At Alzheimer's San Diego, we like to describe the management of dementia symptoms as a three-legged stool: medications, behavioral interventions, and caregiver support. There are currently 5 FDA-approved medications that are available to treat the symptoms of Alzheimer's disease, and they are often prescribed in other types of dementia as well: Aricept, Namenda, Exelon, Razidine, and Namzaric. These medications are FDA approved to treat the symptoms: memory loss, cognitive changes, difficulty with thinking. And for many people, what they'll do is delay the progression of those symptoms, sort of slow that down a bit. But unfortunately, at this time, we do not have any medications available that halt the disease process itself. Behavioral interventions. This is a key focus in our education program for care partners at Alzheimer's San Diego, identifying those things that might be triggers for a person who's living with dementia, and then making changes to help address those triggers. So this could be modifications to the person's environment or changes to the way that we communicate, for example. And finally, a third and very important leg of this stool is providing support to caregivers or care partners. This is helping people understand the disease process, helping people learn new skills for providing hands-on assistance, for example, or learning those new, more effective communication techniques, connecting people to resources. This could be healthcare resources, long-term care resources. It could be the network of friends and family in your natural support system, or it could be your own internal resources. And finally, helping caregivers find opportunities for respite is really important. So adjusting to a new normal in living with memory loss, adapting to a new diagnosis of mild cognitive impairment, Alzheimer's disease, or some other form of dementia, there is a wide range of new emotions, new feelings that a person may be experiencing. And it's really important to just get in touch with what it is and acknowledge what it is that you're feeling. It could be anger, it could be grief, it could be sadness or fear or anxiety about the future. For some people, there's an unexpected sense of relief because, well, at least now we have an explanation for some of these sort of strange symptoms and changes that we've been seeing. Whatever you're feeling, it's normal, and other people feel it as well. You need to give yourself some time to adjust to this new normal, be kind with yourself and flexible as these changes come. We need to let go of our previous expectations of ourselves or of another person, the person that we're caring for, or the person who's caring for us. We need to be patient and forgiving of ourselves and other people. And it's really important that we learn everything we can about this disease process, about these new skills, about these new ways of coping with all of these changes. So underlying all of this is the importance of having a good, solid support system. So we'll talk next about how to build that support system. So an important first step in building your support system is telling people what's going on. So with whom do I need to share the information about this diagnosis? Well, basically, anybody that could be a part of your support system, they need to know. This is family, friends, coworkers, other members of your support system. But not everybody in your life needs to know. Talking with children and young adults about Alzheimer's disease and other forms of dementia is important, but it does need to be done with some care. keeping in mind how old the child is or how able they may be to take in this information. If you need tips and strategies for talking with children, at Alzheimer's San Diego, we have resources on this topic. We also have a nice selection of children's books in our lending library that can provide some good talking points around Alzheimer's disease and other types of dementia and what they might expect. When do I need to share this diagnosis? Well, this is a very individual, very personal decision, but what it comes down to is we need to share when the person needs to know. When your symptoms or your health may begin to impact that person, this is the time that we need to share the diagnosis. Or when the time comes that you're ready for their support, you want them to be a part of your team and you feel comfortable. And then how to share the diagnosis. This is, again, a very personal decision. Many people prefer to have a face-to-face, in-person conversation to share the news about a new diagnosis or memory changes that a person is experiencing. But certainly, if communicating by phone or in an email or even using social media, if that's comfortable for you, these are perfectly acceptable methods of sharing the diagnosis if they're comfortable for you. Do be aware that often persons who learn that someone they care about has a new diagnosis of Alzheimer's or mild cognitive impairment or some other form of dementia, they often have a lot of questions and they need to talk about their own fears and concerns. Just offer to connect these folks with information, with supportive resources. We have a great deal of information available on our website. And we also have other resources, a lending library, we have a video library, information that you can share with other people to help them learn on their own more about the symptoms of dementia and what to expect. So that strong support system has you in the middle of it, which you see here. You, in this instance, may refer to the person who is living with memory loss. It may also refer to a care partner. Care partners need strong support systems of their own. So you see here depicted in this image the variety of different types of people who may or may not be part of your support system. So do some thinking about who is currently a part of your support system. Where are the gaps? Are there individuals who might be able to be better sources of support to you if they knew more about what was going on, or if you felt more comfortable asking for their assistance? A strong support system is one that communicates regularly with you and with each other as necessary. A good support system is flexible and responsive because these diseases can be difficult to predict. We need a group of people and professionals and supports who are able to recognize when things are changing and be flexible and respond quickly. And the whole point of a support system is that it is focused on the quality of life for the person who's living with dementia and their care partners. Everybody has a different role to play, but everybody is focused on that same goal. So in building your support system, probably the muscle that needs the most exercise for most of us is that muscle that allows us to ask for help when we need it, right? Stay connected to people, activities, places, things that you enjoy. These are important sources of support to you on the hard days. If you are a part of a spiritual or a religious community, stay connected or reconnect if that is something that you have lost. We really recommend finding a support and discussion group. We offer dozens of different groups all over San Diego County, as well as virtual support groups. And there are many other organizations, both in San Diego County and around the country, who can provide this safe, comfortable, confidential place to talk about the challenges of living with or caring for somebody who has memory loss. Having opportunities every day to take a break is critically important. We really need some source of regular respite built into our life. So those sources of support in your life, one of the key functions that they can provide is stepping in and giving us an opportunity for a little bit of a break, whether that means a full-fledged vacation, or if that just means 5 minutes to step outside, get a little fresh air, have a cup of hot tea in the sunshine, whatever that might mean. Those daily breaks and daily moments of respite are very important, both for the person who's living with the symptoms as well as their care partners. We'll talk now a little bit about some strategies for coping with the daily challenges of living with memory loss. Communication is one of the great challenges in Alzheimer's disease and other forms of dementia. Some of the common changes that we can expect to see in people with dementia are shown here. Difficulty finding the right words when speaking or understanding the meaning of other people's words. This could be spoken language. It could also be difficulty with reading comprehension. For many people, it becomes difficult as the disease progresses to filter out background noise. That could be auditory sounds, but it could also just be other things that are going on in the background. A television, children who are playing, a lot of activity or visual stimulus outside of a window, for example. It can be difficult for a person who's living with dementia to filter out sort of visual or auditory clutter and focus on the person that they're trying to communicate with. We frequently see in people with dementia that as the disease progresses, it becomes easier for them to understand things that they see than things that they hear. This just has to do with the way that the human brain is wired, and it's not universal, but frequently individuals who are living with dementia have a much easier time understanding visual cueing rather than hearing a set of instructions, for example. It's not uncommon at all for a person with dementia to become frustrated when communication with another person isn't working, right? Either you're having a hard time understanding what I'm saying, or I'm having a hard time understanding either the words or the unspoken messages that are being communicated to me. And then for persons who speak more than one language, it's not uncommon at all for us to see what's called primary and secondary language confusion. Often our memory, our ability to retain and use our native language, the first language that we learned when we were children, that language we retain better as the disease progresses. So sometimes we'll see people kind of switching inadvertently back and forth between 2 or maybe even 3 different languages, and this is not intentional on that part. It's actually a very important thing to remember that none of these changes are intentional. The changes to the way that a person communicates, these are symptoms of a progressive disease. A person who is struggling to remember or find the right words, or who is maybe asking the same question over and over again. This person is not doing these things to be difficult. They're doing them because they are experiencing brain changes, and these are symptoms of their disease. So when it comes to communication, here's some tips for kind of setting yourself up for success. Slowing down your speech and talking as clearly and as directly as you can, minimizing the use of unnecessary words as much as you can. On the same note, in slowing down, just take your time. Don't try to have a conversation, communicate about something that's important when you're in a hurry, right? Sit down, focus, and take your time about the communication. It might be helpful to adapt the physical environment, remembering that it can be hard for someone with dementia to tune out all the background noise or environmental clutter. Repeating yourself can be very helpful, and repeating a statement or asking a question exactly the same way, the second or third time that it is repeated, can be very helpful. This can be challenging because often when we have to repeat ourselves, we feel frustrated or annoyed that we have to do so. That's a totally normal and natural reaction, but take a deep breath and remember that in saying this, making this statement again, or asking this question again, for the person who's living with memory loss, it may be the first time that they're hearing that statement or that question. So take that deep breath and repeat yourself with kindness and generosity and patience. And if a communication is not working, don't hesitate. Take that deep breath and shrug it off, right? Decide if this conversation does not need to happen right now in this moment, if this is not a critically important conversation for us to be having, maybe I can try again later. So here we have some tips for making daily life as easy as possible for a person who is living with memory loss. We hear from many people that having a fair amount of structure and routine in your life, in your household, and in the course of your day can be very helpful. Whatever activities you find meaningful, keep those. Continue engaging in those activities, seeing those people, not focusing on all of the things that we have lost, all of the ways that our abilities have declined. Instead, think about what are we still able to do? Who do we still enjoy? What activities bring us a sense of purpose? And focus on those. We will probably have to be a bit flexible and forgiving as symptoms progress and as abilities change, but there are always strengths and abilities and things that we can still do and things that we can still enjoy. So this may mean that we have to make some adaptations to our environment. We may have to ask the people around us to be a bit more flexible and forgiving. But for example, if you have played in a bridge club for years and years, and that is something that is meaningful and enjoyable to you, and you enjoy spending time with those people, and as memory changes and cognitive changes progress, it may get more difficult to be able to play bridge. But keep that activity in your life, right? Continue to see the friends, maybe go to the bridge club, engage in the ritual and the routine of bridge while making adaptations to the way that you can participate in the activity itself. Again, this very important topic of just getting a break, right? When you need them. There are going to be days that are hard, and know when it's time to kind of rest and take a break when you need it. And at all times, as best you can, try to keep a sense of humor about some of these silly and downright absurd things that happen while living with memory loss or caring for somebody who does. Taking care of yourself, critically important much easier said than done. We do know this, but it's very important for a person who is living with a progressive condition like Alzheimer's disease or other forms of dementia to focus on your health. Remember, you've still got lots of healthy brain cells in there. We want to keep them well fed and well rested and stimulated as for as long as possible. So focus on nutrition and a healthy diet, staying physically active or getting more physically active if you need to. Sleep is often disturbed in people who are living with dementia and their care partners. So talk with your physician or your mental health practitioners about methods for improving your sleep and controlling or managing your stress levels. Stay socially active and certainly keep cognitively active. Continue to enjoy those intellectually stimulating activities that you enjoy or engaging in new activities. Do focus on keeping yourself safe, both for the person with dementia who may be more prone to falls or household injuries as a result of these brain changes, as well as care partners who may not be physically conditioned and ready to provide hands-on assistance to another person. Thinking about keeping yourself healthy also needs to include thinking about ways to stay safe and prevent injuries. So be in touch with your healthcare providers regularly. This goes not just for the person with a diagnosis, but for care partners as well. Right? Keep your health information, your legal affairs, your financial information, keep all of these things up to date. So let's talk a little bit about some of these legal and financial considerations that you might be thinking about. So the term advanced care planning is a broad term that we use to describe all of the conversations and communication and documentation that we can do to make sure that if down the road we were not able to make decisions for ourselves or communicate our wishes, that those people who are named as our decision makers know how we define quality of life and have the information that they need to make sure that we have it. So I encourage everyone to think about how you personally define that term quality of life. What does it mean for you to have a good physical quality of life, to have a good emotional quality of life? Who are the people and the activities that you need to feel cared for and loved and supported? A practical quality of life. What are the things you like to eat or the things you don't like to eat? The things that make you feel comfortable and whole, the places you like to spend your time. And then finally, quality of life for many people has a spiritual dimension as well. So what I mean to say here is we don't want to assume that even the people that we know best or that we believe know us best, we don't want to assume that they know how we would personally define quality of life in all of these areas. So it's really important that just as soon as we can, we engage in some reflection on what these things mean to us, that we document it, we get it down on paper. Here's what I want, here's what I don't want. And most importantly, that we communicate. The people that we are naming to be our decision makers down the road, or the people who will communicate our decisions, it's really important that they understand, here's what quality of life means to me. So here we have a list of some key documents that can help us provide instructions and also authority to those individuals that we have named to make decisions on our behalf. should that become necessary. A power of attorney document, this is something that every adult over the age of 18 should have in place and should keep current. It's a very simple document that names, you name an individual as your agent for power of attorney. So this person has your permission to make decisions about your finances or about your health care. There is a power of attorney for asset management and a power of attorney for healthcare. There are two different documents that give a person this authority. It could be the same person, or these could be two different people. An advanced healthcare directive is a detailed document that gives your power of attorney for healthcare detailed information about what you want and what you don't want when it comes to healthcare, life-sustaining treatment, for example, end-of-life care, or even information about your long-term care preferences. This is the tool that you can use to make sure that your agent for power of attorney for healthcare is really clear on what it is that you want. Wills and trusts, of course, are estate planning tools that are used to designate what you want to happen to your property. The post form is a very important tool for anybody who's living with a chronic condition. The physician's orders for life-sustaining treatment. This is a form that's significantly different from the do not resuscitate order, or the DNR form that many of us are familiar with. The DNR is a very specific document, and it relates to whether or not you wish to be resuscitated should your heart stop. A DNR form is specific to the provision of CPR, and it's really only valid in the healthcare setting where it was signed. A post form is something different. This is it's a still fairly simple document, but it's two-sided. It's more detailed. It is about more than just CPR. It is about your wishes with regard to all different types of life-sustaining treatment, or sometimes called heroic measures. You would fill this form out. It's a simple free form. You can just download it online. You fill this form out and bring it into your doctor's office. You have a conversation with your doctor about it, and then they sign it. So it is a signed and standing physician's order. It's relevant in any setting. So first responders who come to your home, or if you're in a hospital, or if you live in a residential care setting, the post form is valid in any setting. And then finally, a really important but often overlooked document is the HIPAA waiver. The Health Insurance Portability and Accountability Act. This was federal legislation that protects our privacy, the privacy of our health information. This is important legislation. It's a good law that we have in place, but it can be a very difficult barrier for a care partner if a person has not provided a HIPAA waiver, if they've not given permission for someone else to, for example, talk to their doctor or access their medical records or get information about them when they are hospitalized, for example. Frequently, a person, even a very close family member, next of kin, will struggle to have access to the information that they need in order to follow your wishes. So talk with your healthcare provider, your health system, or your preferred hospital about the forms that they require. Get those forms now and get them completed and on file. A quick look at very important financial issues in care planning. We really have to take a hard look at the very high cost of long-term care. It's very important that everyone be aware Medicare and other traditional forms of health insurance do not cover long-term care, right? Medicare, TRICARE, Blue Cross, right? All of these are health insurance programs, and they're terrific, and they cover a lot of our skilled healthcare needs, but they do not cover what is called long-term care, right? The in-home care services, assisted living apartments, memory care, residential care, for example. Those non-medical services are considered long-term care. And long-term care is very expensive. For most people, they are using personal savings and assets to pay for long-term care, and the costs can be surprisingly high. So we really encourage you to take a look now at what home care costs. Take a look at assisted living and memory care rents in your area, so that these costs are not a surprise to you down the road, should you need them. Insurance, there is private long-term care insurance that many people, if they can afford the premiums, can purchase to help cover some of the costs of long-term care. There are also some creative financial planning tools that are available, reverse mortgages, for example, charitable gift annuities. There are some ways to sell old life insurance policies, for example, to help you cover, to help give you cash to pay for the cost of long-term care. So we do encourage you to talk with a financial advisor, and specifically talk to a financial advisor who really understands issues related to long-term care. Two other programs that are available to support people who may have inadequate personal savings or assets to pay privately for the cost of long-term care. The Medicaid program, which in California we call Medi-Cal, and then of course the Veterans Administration, which not only provides health care and service-connected pension, for example, but there are some benefits that are available to veterans, specifically related to long-term care, or for veterans who are caregivers to another person with long-term care needs. So we get a lot of questions at Alzheimer's San Diego about, is it safe for me to be living alone anymore? Or is it safe for me as a care partner to leave my person with dementia alone for short or long periods of time? So when we talked about the progression of the disease, I pointed out that there is no sort of concrete moment at which, we can say, okay, officially this person is in the middle stage of the disease, and therefore they are no longer able to be alone. It's just not quite that black and white. But here are some questions we would encourage you to think about in exploring. Is this person safe to be on their own? Would this person be able to recognize danger? If a smoke alarm, a fire alarm of some kind, a flame burst out in the kitchen, if the care partner was in some kind of medical emergency, if the care partner fell and was hurt or lost consciousness, would the person who's living with memory loss be able to recognize, I need some help? Would they be able to call for help in an emergency? Keeping in mind that often stress and being under stress will cause memory issues, disorientation, confusion to worsen. So would this person be able to call for help and wait for help to arrive, and be able to communicate accurately with a first responder, for example? If a person wouldn't be able to recognize when they are in danger or to safely call for help in an emergency, they are generally certainly not able to live alone, but we probably wouldn't want that person to be left alone for any significant amount of time. If a person has a history of becoming disoriented or a history of wandering, we'll talk a little bit more about wandering here in a moment. If they've got a history of getting lost, then they are probably not safe to be left alone. And just anybody generally who becomes significantly confused or agitated when they are under periods of stress, when unexpected things happen, this is probably not a person who can manage being home alone safely. So it's just important. These can be hard things to think about and talk about, but it is important that we recognize that as these diseases progress, most persons with dementia are going to require 24/7 supervision and assistance. So it's just something we have to be thinking about now and planning ahead for. Medication safety is a very important household safety issue for all of us, not just people who are living with memory loss. So we have a couple of recommendations here. Using one pharmacy, if at all possible, to get all the medications coming from the same place. So that one pharmacist is always having one good comprehensive look at everything that's being taken. Really encourage you to not only talk with your doctor about all of the medications and supplements that you or your loved one are taking, but rely on a pharmacist as well. Pharmacists can talk with you about drug interactions. They can talk with you about dosage changes or taking drugs at different times of day, which might be helpful. A pharmacist can be a really wonderful support. Using simple tools like notepads or pill organizers, pill boxes. There are some very fancy electronic pill boxes that are out there and available. But for the average person who's living with the symptoms of dementia, an automated pill organizing box is going to be difficult to navigate. So simple pill boxes and good old-fashioned having another person there to help you set up your pills and remember to take them as scheduled is generally best. As with many other aspects of living with memory loss, having as much routine and structure in the day as possible can be very helpful in terms of remembering to take medications and taking them the right way as they have been directed. Driving is a very difficult conversation for a lot of people who are living with early memory loss and thinking ahead about the future, and very, very difficult, touchy subject for a lot of care partners to have to bring up. It just needs to be said that cognitive impairment due to the symptoms of Alzheimer's disease or another form of dementia will impact a person's ability to drive safely, regardless of how many years they've been driving, how skilled careful of a driver they are or have been for any number of years. These are progressive conditions that cause a variety of different changes. And so we have to be practical and realistic. There are resources out in the community for obtaining an objective driver safety evaluation. Here in San Diego County, we have a few major healthcare providers who have what are called driver rehabilitation specialists. These are occupational therapists who can provide evaluations of a person's driving skill. They can make recommendations for changes to the car or to driving habits that might improve a person's safety. The DMV, the Department of Motor Vehicles, of course, is often involved in making the decision about a person's ability to drive. Do be aware that in California, there is a law in place that requires a doctor who makes a diagnosis of what is referred to as a dementing illness. This does need to be reported to the county, and then the county forwards that information along to the DMV. It is not a doctor who makes a decision about a person's ability to drive. It's DMV or law enforcement ultimately who make those decisions about driving privileges. But certainly, a doctor can make a recommendation to the DMV or directly to their patient that they think that this person should not be driving. And absolutely, we recommend following the recommendations of the physician. Any concerned person can contact the DMV directly and request that something called a request for reevaluation form. You can download this form, and request that a person be reevaluated if you're concerned about their safety. So this is a free and confidential form that can be downloaded from the California DMV website. Certainly lean on your doctor for their assessment of a person's safety and ability with regard to driving. And very importantly, before having a conversation about not driving or limiting driving, it's very important that we address transportation alternatives and we have a plan in place. We don't want to simply take away a person's driving privileges, remove the car, for example, without providing them some means to get to the places and the people and the activities that are important to them. So here's that very important issue of wandering. Do be aware that every person with dementia is at risk. The statistics confirm that the vast majority of people who are living with memory loss, who have a progressive condition like Alzheimer's or another form of dementia, will wander at some point during the disease process. It can happen on foot, but people can also wander while driving cars or while on public transportation or in a taxi or an Uber. So a couple of suggestions. We do have a lot of classes and information and resources related to preventing wandering, some things you can do around the house. But the most important thing to be thinking about for right now is what we call wandering response, right? Having a network of people, friends and neighbors who can keep an eye out. Listen, I have a diagnosis of dementia, and if you were to see me out by myself, looking confused and disoriented, here is my daughter's cell phone number. Please give her a call. Right? These can be hard conversations to have, but having a neighborhood, a network of people who are keeping an eye out can be invaluable. In addition to that, or if that is not possible, we do have two programs here available in San Diego County. The Sheriff's Department operates the Take Me Home program. It's a free and safe online database that is operated by the Sheriff's Department, wherein you can put in some key information about a person and a good close-up photograph of their face, so that in the event that they became lost, the local law enforcement jurisdiction would have the ability to just start that search right away in an informed way. They've got information about them. They know where to start looking. They know things like nicknames and places they might be inclined to go. And of course, they've got that good photograph of their face to help them in their search. So Take Me Home, as well as Medical Alert. Medical Alert San Diego, we've got a partnership with them at Alzheimer's San Diego and can help you get a bracelet or a pendant or wallet cards or clothing tags, for example, which can be used to identify a person as having memory loss. And this connects to a nationwide database. And in the event that they were found, a person who sees the bracelet or sees the tag can call a phone number, find out who they are, and get them connected to their primary contact and get them back home as quickly as possible. So that's what wandering response is all about, having safeguards in place to help a community better support people who are living with dementia and get lost. You can find information about these programs as well as things like GPS devices and other technology options that might help. You can find this on the safety page of our website, alzsd.org/safety. And finally, another difficult but very important conversation that often needs to happen, and that is conversations around firearms and other weapons. As with driving and access to an automobile, the progressive cognitive impairment that a person who's living with dementia will experience will affect their ability to handle firearms safely, regardless of the number of years that they have done so or their skill or care in doing so. So it's very important that people with a new diagnosis, people who are living with memory loss, or their care partners talk about ways to either remove weapons from the house or facilitate transfers of ownership of those firearms if it can be done. If the weapons cannot be removed or the ownership can't be transferred to someone else, perhaps the ammunition can be kept separately from the firearm. The firearms can be kept in a locked safe. And at Alzheimer San Diego, we have a supply of free cable gun locks that we can give out to families who need them. It's a very simple cable lock that goes through the barrel and renders the firearm unusable. But this way, at least the firearms do not need to be removed. The person can have full access to them, but we can be assured that it would not be discharged accidentally in a moment of confusion or disorientation. If you need help around having these conversations about, or you need some assistance with the removal of weapons from the home, give us a call. At Alzheimer San Diego, we can supply you with these gun locks. We can connect you with local law enforcement entities who may be able to be of some support. So let's talk in conclusion here about some of the resources that are available for ongoing help and support for a person who is living with memory loss. Again, you have to learn to flex that muscle, ask for help when you need it, and maybe even more importantly, grow comfortable with accepting help when it is offered to you. At Alzheimer San Diego, we provide a remarkable array of free support, resources, and direct services to people who are living with memory loss related to Alzheimer's disease and other forms of dementia or not. You do not have to have a diagnosis to access most of our programs and services, and everything that we do is provided at no cost. We are a local organization. We're headquartered in Kearny Mesa. And we have a remarkable team of master's level social workers who are there to talk to you by phone, to answer questions via email or live chat, to help connect you to a support group, to help you find activities to stay active and social and engaged, to help connect you to respite resources, or maybe even help you find a clinical trial that you could participate in. Everything that we do at Alzheimer's San Diego, again, is free, and our services are open to anyone who needs them. So here you see you can visit our website. You can contact our team of dementia care consultants directly via phone, email, or live chat. Or stop by our office in Kearny Mesa. We provide in-person social work consultation. We have a lending library and lots of in-person programming that happens there at the office, as well as at community sites around the county. So thank you very much for your time and your attention. Please contact us if we may be of any additional information or support.